excited to welcome to the program Rural Doc Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And we are ready to have an amazing topic today. We're going to talk about acetaminophen use. Is acetaminophen Tylenol safe to use?
Well, yes. If you use it according to directions. It is, however, the most commonly used pain medication on our planet Earth.
What is safer, aspirin or acetaminophen?
Depends on, but certainly they both have their risks and benefits. But if you're talking about the risk of acetaminophen or Tylenol, it is liver failure. If you're talking about the risk of aspirin or any of its relatives, NSAIDs, Motrin, ibuprofen, Advil, those things, then you're talking about kidney failure. But Tylenol or acetaminophen is responsible for 70% of liver failure in the United States, the UK, Australia, and New Zealand.
Is it easy to take too much acetaminophen?
It sure is, and that's the problem with acetaminophen. The therapeutic dose runs around 3,000 to 4,000 milligrams a day, but if you take 7,500 milligrams, that is a lethal dose. So there isn't much difference there. So there's a very narrow difference between what's therapeutic and what's lethal. The other problem with acetaminophen is that it's hidden. It's in so many things over the counter. You really have to be careful. You have to read directions. Remember, anything that ends in set probably has acetaminophen in it.
What is the maximum daily dose of Tylenol for an adult?
Well, that varies depending on weight. But if you weigh 150 pounds and you're over 18 years old, the dose ranges between 3,000 and 4,000 milligrams per day.
What are the differences in risk factors for acetaminophen versus ibuprofen?
Well, acetaminophen or Tylenol, again, has liver risk, as we really know well, and ibuprofen or aspirin, Advil, has the risk of kidney problems. It's hard on kidneys and hard on stomach. Sometimes you have bleeding.
Is acetaminophen toxicity associated with liver and transplantation?
Yes, it is. As a matter of fact, worldwide, Tylenol or acetaminophen is the second most common cause of liver transplantation. In the United States, it's the most common cause of liver transplantation.
How should acetaminophen be used?
Well, acetaminophen, for years we've said Tylenol or acetaminophen is safe for pregnancy. Well, we don't know that anymore. The newest information says that we don't really know for sure. It can be associated with ADHD, ADD, and other neurologic disorders. But the bottom line is, if you really need to take Tylenol or acetaminophen, because Tylenol isn't the only kind of acetaminophen, you take it for the shortest amount of time, not to exceed 10 days, and you take it for a very specific reason, and you take the lowest dose possible to give you the symptom relief that you need.
All right. Go to ruraldocallen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the Rural Doc Allen podcast, guys. Take care.